Good afternoon. My name is John Velasco and I'm with Dayton Surgeons. If you're here to see me today for a fistula, it may or may not mean that your kidneys are not functioning completely, meaning you may not yet be on dialysis. Now, if you are on dialysis, you're probably dialyzing already through a catheter in your shoulder, which is providing a way for your dialysis doctor to clean your blood. If you're not yet on dialysis, the reason why you're here to see me is that it usually takes about 2 months, in some cases 3 months, before the fistula has grown or has developed or matured to the point where it can be used in dialysis. Okay, so essentially, if you have kidney failure, it means your kidneys are not filtering out the impurities in your body as they should. And your kidneys are reaching a point where you'll need dialysis. Now, essentially, dialysis is a way for your kidney doctor to clean your blood. Your kidneys are your filters in your body. They filter out all the impurities that your body normally makes. They get rid of the extra water, they get rid of the impurities that your body forms. Now, if your body can't do that, then your kidney doctor, your nephrologist, has the ability to remove those impurities using his dialysis machine. In dialysis, in order for him to clean your blood, he's got to get the blood, your kidney doctor has to be able to remove the blood from your body, filter it through his kidney machine, and then return it back to you after it's been cleaned. Now, the way he does that, or the way his nurses do in dialysis, is to actually place 2 needles in one of your veins in your arm, just like you would for an IV. One needle removes the blood and takes it to the kidney dialysis machine where it's filtered, and then the blood is returned to you through the other tube and the other needle after the blood has been cleaned. Now, here's where the problem is, and here's the reason why you're here to see me. When the physician turns on his dialysis machine, the suction generated by the dialysis machine is so strong that your veins would just collapse. And so you're here for me to build a fistula in your arm. Essentially, it's a way for me to make your veins stronger so that they don't collapse underneath the suction generated by that dialysis machine. So, how do I do that? There are several ways that we can build a fistula in your arm. As far as the types of fistulas, and there are different types of fistulas. There are fistulas made out of artificial veins, and then there's fistulas made out of your own veins, which is what we would prefer to use. Now, in order for us to use your own veins, first of all, we have to know whether or not you have veins that can be used. As you well know, as some people become sick, their veins tend to shrivel up, or they've been scarred from having been punctured so many times from needing blood to be drawn for laboratory tests. So, what we do is on the day of surgery, we send you to the ultrasound lab where the nurses or the technologists there will actually use ultrasound to map the location of the veins in each of your arms. Now, generally speaking, we would prefer to use your non-dominant arm rather than, if you're right-handed, we'd prefer to use your left arm. But having said that, if the veins in your left arm are crummy or are scarred in or are too small to use, and the only good veins that are available are the ones in your right arm, which may be your dominant arm, then that's the vein we would use. Now, so that if your veins are good all the way to your wrist, or if they're only good at your elbow or in your upper arm, that would determine the location as to where the incision would be. Now, the procedure is done at the hospital. It's an outpatient procedure. It takes about an hour to actually do the operation. Now, for you and your family, you should plan on it taking half of your day, because you'll need to be there a couple hours before the operation for preoperative checking in and testing. And you'll also need to get your veins mapped before the operation. The operation itself takes another hour, and then it takes another hour for you to recover after the operation. But most people generally are able to go home that same day. As far as follow-up, you'll see me back in the office at about 2 weeks and then at 2 months. The first visit is to check to make sure the incision is healing properly, and the second visit is usually about the time where the fistula itself is approaching the time where it could be used for dialysis. Now, what questions might you have regarding the complications of the procedure? Well, the biggest risks for the operation are bleeding and infection, and in a few patients, the fistula works so well that it takes blood away from the hand in which the fistula has been built in. And let me explain. As you know, with any operation, if you make an incision, there's the risk of bleeding. And if you make an incision, there's a risk of infection. We take steps to make sure that that is minimized, such as giving you antibiotics beforehand. If you're on blood thinner before the operation, we may ask you to stop it to help decrease the chance that there will be problems with bleeding afterwards. As far as this third complication, which blood is in which the fistula takes too much blood away from your hand, that is known as a Steele syndrome. Essentially, the fistula works so well that not enough blood is directed to your hand. Some of the blood is actually directed back up into the fistula, so your hand does not receive the amount of blood that it did before, and in some people it doesn't receive enough blood because too much of the blood has been directed into the fistula. If that occurs, you should contact your physician, you should contact your surgeon immediately to let them know of the symptoms, which are generally pain, numbness, or coolness, or decreased strength in that hand on the side that the fistula has been built. As far as what to expect after the operation, generally speaking, the requirements or your needs are very minimal. And let me elaborate on that. The incision is usually a small incision, usually a couple inches long. Sometimes, if the vein is deep and is on the inside of your arm, we may have to make a longer incision, in which case the incision may be 4 to 6 inches long. Either way, most patients are able to go home the same day after the operation. Most of the times, the incisions are closed with sutures that are underneath the skin, so they absorb. There aren't any stitches or sutures to remove after the operation. Now, also, we usually seal the incision with Dermabond. It's like super glue, only it's medical grade, and the glue comes off of your arm after about 7 to 10 days, at which point, by the time the glue comes off, the incision is healed. As far as limiting activities, generally, we'll ask that you not sleep on that arm. If you're someone who likes to sleep with their arm underneath their head, we'll ask you not to sleep on that arm or to keep that arm elevated on a pillow for the first few nights after the operation. As far as activities, usually you can resume all your usual activities within just a day or two, provided it doesn't involve getting your arm soiled. For example, I wouldn't want you digging in your garden or changing the oil in your car, thereby potentially exposing the incision to dirt or germs for about a week or two after the operation. As far as care for the wound or the incision, usually it is okay to shower within 24 to 48 hours. I wouldn't recommend that you soak the incision or take a bath or submerge it, but to take a shower to let the water run over the wound and pat it dry is perfectly fine. As far as driving is concerned, most people you shouldn't drive that day after the operation, and you shouldn't drive if you're taking prescription pain medication. But in the absence of that, most people are able to drive within just a few days. If you have any questions regarding what's involved with a fistula, please feel free to contact our office, or if you're watching this video before you see me here in the office today, I'd be happy to answer any questions that you might have regarding what's involved with making a fistula or the care of a fistula afterwards, or any other related things regarding your dialysis. Now, I may not have all the answers, but with regards to your fistula, I'd be happy to answer them the best I can. Thank you for your time.